So we are thrilled to have Dr. Carli Blau join us today. Carli will be discussing sex, cancer, and self-love. Carli is the only sex and empowerment therapist and women's health doctor in New York City. So we have had Carli here before. We are beyond lucky to have her again, and we'll discuss later about how Carli is also going to be joining the team through our behavioral health program that Woman to Woman has. So Carli, thank you, thank you, thank you. We are thrilled to have you today.
Thank you so much. Thank you, all of you, for being here, for trusting in me to be a part of this experience. It's such an honor. I muted myself. You might see me mute myself at some point. I have a bunch of doggies in my house who are very vocal, and that's the con of being from home. But so that's the only thing you might hear. I put together a little presentation for us today, and that I thought I'd walk us through. And I want to make this the most comfortable for everyone. I'm a therapist, and I love talking. I love hearing what people are thinking and feeling and what's going on in people's minds. Really giving everybody a space, giving me a space to understand you and for you to feel understood is so incredibly important. And so I want to make sure that there's space, even though it's being recorded. If you want to keep your name off, if you want to keep anything off, if you don't even want your voice to be heard and you want to put it in the chat, me and Jillian will be able to tend to those questions, but I want you to have a space to be heard and to feel acknowledged, and I will do my best to do so. I'm going to go ahead and share my screen. Let me see, Jillian, bear with me here if this works. Let's see. Can you see my screen?
Yep.
Cool. Okay, let's see. Can you see my screen now?
Got it.
Cool. And I'm going to just make myself really small. Okay, so I can't see anybody else's faces or boxes or anything other than if anyone's talking. So if I don't see your hand up or anything, Jillian, will you help me if anyone is speaking or if I don't hear anybody?
Absolutely, no problem.
Okay, so I'm going to talk today about sex and self-love through cancer. Let's see. Okay, so who am I? Why are you here? Why are you listening to me? A tiny little blip. I think it's always important to kind of get an idea as to who you're talking to. Jillian, thank you for the introduction. It's what you said was all true. To kind of give you all an understanding, I'm very, very, very interested in the intersection between mental health and the mental health space and medical health, and where doctors are not being trained and taught to effectively treat the emotional aspects of all the things we go through from medical treatment. My research and my PhD is in clinical sex therapy. I did research in infertility-related sexual stress and sexual esteem, looking at whether or not people who go through infertility feel less about themselves sexually in particular. And then I studied women's health issues and the intersection between mental health and female medical health related issues, including cancer and endometriosis, polycystic ovarian syndrome, infertility, pelvic floor dysfunction, anything that's related to medical health and the intersection between that and mental health. But I'm here today to talk to you about something that I'm very well known for, which is sex therapy and also self-love and what does that look like. So I figured we would talk, I want to be able to see everyone. Does anyone have an idea, or has anyone ever heard of, oh goodness, how do I get back? Eek. Hold on. Has anyone ever heard of sex therapy, or is anyone familiar with it at all? No? Okay,
No hands are up.
That's okay. So
I did go to a sex therapist. I'm throwing it out there. So in case anybody else needs somebody to say it first. So I did go to a sex therapist with my husband at some point.
Yeah. And sex therapy.
After my diagnosis.
Sure. And thank you so much for being brave and sharing. I really appreciate it. Sex therapy is so interesting. So we know what psychotherapy is, right? Basic mental health therapy, where you have emotions and feelings about whatever you're going through in life. And so you see a therapist who's a clinically trained professional to help you deal with what you're feeling, your emotions, and the ways that it impacts your life. Sex therapy in particular, everyone thinks Dr. Ruth. I like to think now people start to think of me too, it is a form of psychotherapy that uses a non-pathologizing approach, and it emphasizes sexual freedom, feelings, fantasies, and healthy modes of sexual activity, and sexual feelings so that you can live your most sexually fulfilled life. I don't know about you, but I did not grow up in a world where sex was talked about. I didn't grow up in a world where I was taught about healthy sex and what healthy sex means. That wasn't something that I learned. I actually, funny for you to know, I had a friend growing up whose parents had like a wall of books. And in their wall of books, they had a human sexuality book. And I used to read the textbook at every sleepover. And that's how I got so educated from a really young age around what sex was, because I was fascinated that there was this topic that no one was talking about. And so sex therapy allows clients to consider what their sexual experience has been over their lifespan and what their sexual experience is currently like and what priorities they have for their sex in the future. So let's talk about some of the ways that sex has been impacted by a person's journey through cancer, right? Whether it be through first noticing something on the body and then being worried about it, not noticing something on the body, noticing something has changed, going for an appointment, from an original diagnosis through planning treatment, receiving treatment, post-treatment, remission perhaps, right? Like there are all these different, I was really mindful today when developing this lecture that I wanted to be inclusive, that no matter where somebody is on their journey through cancer, that this applies to everyone to kind of understand, how it might relate to you. So is anyone willing to name one thing that has changed in your sex life as a result of your journey through cancer?
Elisa, your hand is up.
Hi, thank you for this. I feel like we don't have any intimacy anymore. And like anytime I'm naked, I feel like it's for a doctor's appointment or getting into a surgical gown or like going in for an MRI or not. I'm not getting naked for the MRI, but you know what I mean? Like, I just feel like anytime I'm like vulnerable in that way, it's for a medical reason and not for pleasure anymore.
I appreciate that so much. And what's wild to me is intimacy is not something we have ever, I don't think, correct me if anyone feels differently, but from speaking to hundreds of women a year, intimacy and sex are not things that are taught as things we should deserve, want, and need. They're not things that we learn to prioritize because we just should want them and they feel good and they bring us joy. So it's interesting, to think about the ways that if intimacy is having a hard time being promoted in our lives as something we should want on a daily basis, then we go through something like cancer, right? And we're going to medical doctors and we're going to appointments and for scans and ultrasounds and mammographies and all the things. It then becomes an even smaller priority, right? Like we don't prioritize feeling intimate. So I really appreciate what you shared. And today we're going to talk about some of the things that we can do to reignite the intimacy and bring it back into your world, because that's what I love to do.
And Denise also wrote in the chat, she said, it feels like my...
Hold on, Jillian, I think you cut out for a second. I didn't hear you. Is anyone else able to hear Jillian, or is it just me? No? Oh, okay.
No, she cut out.
Okay, we'll get her back.
Either.
We'll get her back. Let me just pop my head into the chat myself and then I can help out here too. Yeah.
So sorry, I'm in the office and you have to reconnect every 30 minutes to the internet.
Don't worry, I got
I'm
you
so
back.
sorry. So Denise said, it feels like my body isn't mine anymore.
Yeah, and that is something that women often report. I hear it across patients in general who are going through anything in the space of chronic illness, where it kind of becomes that whatever you're battling becomes your body rather than your body is battling this thing, right? And it's this nuanced piece of how do you maintain that, who you are and how you feel without it feeling like it defines us. I know that there's one more thing in the chat, but Jillian, you got my back. Okay. So let me make myself a little smaller here. All right. So research suggests that more than 60% of women with cancer experience sexual dysfunction, right? Interestingly, the treatments for cancer, such as chemotherapy, radiation, they're not known to directly cause sexual dysfunction. But remember when I said to you at the beginning of today that this is what I'm fascinated by? Medical doctors are brilliant. I love them. I love medical doctors. I think they help us treat the things that we're battling and the medical conditions that we're battling, but they're not often taught how to manage the emotional aspect of what they treat, right? And so sexual dysfunction can be physical, but it can also be something emotional, right? Feeling like our body is not ours anymore, feeling like we're disconnected from intimacy. The side effects of these treatments can also cause hormonal, physical, and vaginal side effects that impact our sexual functioning, desire, and arousal. And then chronic illness and diagnoses and cancer are also known to have long-lasting impacts on the body physically and also on our identity and the way we see ourselves in the world around us. And it's very interesting to me to really think about the ways in which a woman's battle through cancer, whether it be through the diagnosis process, treatment, and remission, sexual dysfunction occurs both emotionally and physically. And oftentimes doctors don't have the tools to inform their patients on how to handle that. And that's kind of what my role of Women to Women really looks like for me, is being able to be that person for the team that can help women work through that, because that is a really big part of our functioning. Okay, so
Carli, Desi also wrote, and I'm assuming this is something that you're going to be getting to, but she said it is hard to feel the same desire or turn on.
Oh, yes. I'm going to write down notes just so I keep them desire and turn on. So that brings me to this slide, right? So like a lot of, as we all know, the common physical symptoms, right, are nausea, fatigue, hormonal imbalance, changes in our activity levels, our energy, breast, vulva, vaginal changes, the way that our body looks may change, the way that it feels may change, blood flow and the way that we become aroused may change. The clitoris may not feel the way that it did. Nipples, especially when we're talking about breast cancer, right? When there's a mastectomy, if there's any breast tissue left, if nipples are removed, right? There are all these different pieces that impact the physical symptoms, literally, physically, and then also how they show up in the bedroom, right? Like I've worked with many women who have battled breast cancer and who have had a mastectomy where they no longer have their nipples anymore. And perhaps they have replacement tattoos or they wear stickers that help them feel like they have them back. But there's also the piece of working through, what was nipple stimulation like for you pre-diagnosis? Was that something sexually you enjoyed? And then how do you work through perhaps feeling like that's not something you can enjoy now, right? Because it brings up such sensitivity. And then there's also surgical site pain and scarring. And how does one, to this point, how does one continue feeling sexy despite these consistent symptoms or these ways that our body changes? Is anyone in here listening to this being like, yes, I want to feel sexy again. I'm dying. When I want to know, I think we'll go back, but even before my next slide, like who in here remembers the last time you felt really sexy? I love the laughter. I'll take the laughter. I'll just take it. That's good to me. If there's any other laughter, I welcome it in a good way, right? Of when was the last time we felt super turned on and sexy within ourselves, not because someone else made us feel that way, because we felt that way, because there's a difference. There's a difference. And I did a lecture recently for women over 50. And I loved talking. It was a group of probably 50 women. And we were all talking about it. It's like, we forget that we deserve to feel sexy for ourselves, not for someone else. And that's something that we can get back into. And that's not something that has to go away as we get older and as we age. That's something that, my mom is 66 years old. And I look at my mom and every day she walks in and she is the sexiest woman known to mankind in my eyes. That's because she just carries herself in that way and she makes it a priority to do so. And it's interesting how we forget to do that. Like we just forget that that's something that we can do. So then I go into what are some of the I'm a therapist, right? So I don't work necessarily on the medical side, even though I look at the intersection. I look at the emotional and psychological presenting issues that exist. And they're impacted self-esteem, lowered self-esteem, impacted sexual esteem, which is a new term that I studied, body image changes, physiological changes to the female body, changes in lubrication, right? It's hard to feel sexy when you're with a partner and the vagina is super dry, whether it be to hormone replacement or, you know, if you can't do hormone replacement and a lack of hormones or the side effects of treatment, it's very difficult to feel turned on. I mean, this is why like vaginal wetness is a sign to partners that you are turned on. But what if your vaginal wetness isn't there, not because you're not turned on, but because your body isn't working with you? It's super interesting. It also affects our desire, our sex drive. When your hormones are not working with you the way that they were before, a lot of women report feeling like, I just don't want sex anymore. I forget what it's like to want sex. That's not something I've wanted or felt the desire for in a long time. And oftentimes the changes to relationship satisfaction and dynamics, when sex has been out of your relationship for so many years or months, sometimes people feel intimidated or lost, like they can't get it back, right? Like it's been gone for so long. My partner would think I'm crazy if I tried to create it now. And I push back and I say, why? Maybe they would want it too. Maybe you would go into it with a newfound sense of curiosity, kind of like, you know, 2 15-year-olds who are doing it for the first time. It kind of becomes like that in some magical way because you're doing it differently.
How long was I having in my?
And then also an increase in anxiety and depression as a result of treatment can also happen, which impacts their sexual functioning too.
It was hot.
Okay, so has anyone ever heard of what sexual esteem is? I did not know about sexual esteem as a sex therapist before I decided to study it for my PhD. And what sexual esteem is, it's defined as a positive regard for and confidence in the capacity to experience one's sexuality in a satisfying and enjoyable way. And so today I want to talk about how are we going to redefine your sexual esteem? How are we going to teach you how to have a newfound sexual esteem that is new to the body that you're in today, the body that's sitting there listening to me speak where you are right now. What is self-love? And so this has not been studied yet. I did some extensive research before hopping on with all of you, and self-love and sexual esteem go hand in hand, but there isn't any research to show that yet. So the more self-love we have and acceptance we have, the more sexual esteem develops. And what I mean by that is, if we feel more confident and sexy and desirable within ourselves, then we feel more of a desire sexually. And I think women in particular, forget the connection between these two things. Does this bring up anything for anybody? Is anyone listening to me saying, this lady knows nothing about what she's talking about? This makes so much sense. This resonates for me. I want to hear any of the above. If any of you engage in self-love, and what does it mean to you?
No hands are up.
Okay, so let's talk about it. Okay, what does self-love look like for you? Self-love can be a whole bunch of things. We're going to talk about my method for self-love, but then we're also going to talk about some basic things you can do. Self-love is really getting time to spend with you and feeling sexy in doing that and letting that reignite. So unplugging from social media and screens, getting off of any points of comparison. I think social media has become a beautiful community, including support groups, right? It's an incredible community where you can feel like you're among like-minded individuals who are going through similar things. But it's also important that we stay unplugged for a good portion of the time so that doesn't become our whole identity, right? Because that can kind of be like life-sucking sometimes. Get outside and keep getting outside to enjoy yourself. There was a post recently on, I want to say it was the New York Times or the New York Post, about the power of the 8-minute phone call. You know, if you have a lover and or a partner or perhaps you don't, and you're feeling lonely. Pick up the phone and call someone for 8 minutes. People don't value the little things enough in life. And sometimes it's just making these tiny little changes where it's like, if we all got off the support group today and you went outside and you bundled up and you even just stepped outside of your door, you don't even have to go far. And you pick up the phone and you call someone that you really get joy from, who like makes you laugh and makes you feel good. And you call them for 8 minutes, you'd be surprised the joy that it brings to life. And then if you call a lover and you're like, remember the time we had sex in the back of a car? Do you remember that? Do you remember how crazy that was? Or do you remember that time we made love? And they'd be like, what are you talking about? It's Wednesday afternoon at 12:30. Yeah, but I was just thinking about it and it was such a special memory. Like really reigniting these moments in the brain help the brain remember that you enjoyed these things, and they create newfound desire. If we don't bring it back from the back of the memory into the forefront of the memory, it's really hard to remember that we liked it at all. And then dance around your home. I am a full-blown fan of dancing. If I could have all of us in a room right now dancing to I'm Every Woman by Whitney Houston, I would be there holding you in your hands and we would be dancing and it would be incredible, because the serotonin and dopamine and the brain chemistry that happens when a person is moving. I don't know about any of you, but when music is on and you're just moving, there's brain chemistry that happens that's deeper and more complex than you, that just brings your mood up. So when it comes to feeling sexy, listen to some sexy music. Turn the lights down low. Wear lingerie. Nap with permission. People think I'm crazy when I say these things, but it's like, I did an event for Hanky Panky, a sexy women's lingerie brand in New York City. And I was talking to the president of it. And we were talking about how someone wore hanky panky lingerie to a board meeting underneath their blazer and blouse and slacks. And they felt like the most empowered person in the room, not because anybody else knew what they were wearing underneath their clothing, but because they knew that power within themselves. And I think that can be something so empowering for us to just exercise. And then, okay, so this is my like creme de la creme. This is my little recipe, okay, for how do you feel more sexual desire? How do you love yourself a little bit more? How do you redefine what love looks like for you? I say, we're gonna go through them really quickly. I say you dance a little and let go a little every single day. We take life so seriously, and we only have the control of what we're doing right this minute and where we are today. Some things, when we surrender to that, the beauty and the relief we feel can be huge. So dance a little, put on some music, and put on music that makes you feel sexy. And then get sexy for yourself. What does that mean? When was the last time, if anyone's willing to share, that you got dressed in a sexy way just for you? Just for you.
I did when we went to a wedding in September.
And how did you feel, Mimi?
Excuse me. I felt good. I definitely stepped out of my comfort zone in terms of the blouse that I wore, but I decided, what the heck? It was a fancy wedding, and I wanted to look good and feel good. And so that's what I did.
And did it impact your mood that evening?
I think so. I think it did. For the better. Yes.
Yeah. And I love your smile right now talking about the way that you felt that evening.
It was a good blouse.
Yes. Well, you know what? It's also an empowered woman wearing the good blouse. Right? Because the blouse is just the blouse, but it's you that shines in the blouse. And that's the thing that we forget. We are what shines. And if we do a little something for ourselves every day, and you wear a sexy blouse once a week, it's amazing what it does for the way you feel about yourself. I love that. Thank you for sharing that. That is awesome.
You're welcome.
I also remind women in particular, be kind to your reflection. When a woman is battling cancer, however it affects us, whether it's a physical effect in our hair, in our breasts, in our vulva, in our vaginal functioning, our abdomen, with ovarian cancer, all the different types, surgical sites and scars, we're often not kind to ourselves. We look at ourselves and we fixate on the way we once looked and how we look different from her, who she used to be. And I remind us to be kind to ourselves. I know this is a difficult topic, and today is kind of an opening of a chest to kind of talk about the things that could be connecting for you, perhaps watching this. But how can we learn to be kind to ourselves? Because it's really hard to feel desire and intimacy if we're not nice to our reflections. And that's real core work right there, because our identity changes, our body changes, our vision changes. And yet we still deserve to be nice to ourselves and who we are and who we see, because that's who we see every single day. And then I say, work hard with pride to feel proud of yourself. Whatever you do every day, do it with pride. Do it with pride. Be proud of yourself and what you've accomplished. Even if all you could accomplish today was getting up and getting dressed and brushing your teeth. Be proud you did it. Be nice to yourself. As a therapist, I will tell you, most people are not nice to themselves. Most people are not nice to themselves. And it is the one thing in therapy I shift, because people know me. I don't tolerate that in a good way. There's no room. There's no oxygen. There's no space worth not being nice to you. You're what you have. You're all you have. Every day you go to sleep with you every day. That's the best sex. That's the best love. The one you give to yourself. And it's energetic. It's an energy that's attracted. So when you give it to you, it's given to you too. It goes both ways, right? Masturbate. I'm going to give you a tool. Something called omgyes.com. It is an incredible resource that was made by doctors and scientists for women of all ages. It has non-pornographic educational resources on teaching women how to masturbate and how to touch the vulva and the clitoris in a way that can be enjoyable, and promoting it in a way that's not shame-filled and that's just pleasure-filled. As a sex therapist, I went through an immense amount of training with a master's degree in sex education and a PhD in clinical sex therapy. Women are not taught to masturbate. Boys are given so many tools. They're taught amongst friends how to masturbate and all those things. Women are not taught. We are not taught and empowered to engage in self-love and pleasure because we deserve to feel that, period. That isn't something we're taught. And yet it's something we deserve. It's something we deserve so much. And I will add something to this. Find a book on erotica. I don't know if anyone's ever read erotica, but if pornography isn't a thing, erotica or reading a sexy book can be so arousing. And it doesn't have to be arousing in the way that it shows up with someone else. It's re-stimulating the wires in the brain that you have so that you feel those desires again. It's like, what haven't I had in a really long time that I love? What's something somebody hasn't had in a really long time that they love? I haven't had Ben & Jerry's ice cream. I love Ben & Jerry's ice cream. I love Ben & Jerry's ice cream. I love mint chocolate chunk in a big waffle cone dunked in chocolate with rainbow sprinkles all over it. And I haven't had it, but you know what? The idea of that right now brings me such joy. I can taste the mint on my tongue. I can taste it. It arouses my senses because I remember that feeling. Sex is the same thing. It's likened to Ben & Jerry's. If you don't remind yourself on a consistent basis that you enjoy it, and you don't even think about it, why would you want it? Why would you even think about having it? We shut it out of our brains. and we tuck it into tiny little spaces where it gets compartmentalized. And that doesn't do anything for us. We have to keep it alive. And then stick to boundaries that maintain your security. Don't be afraid to say no to someone. Don't be afraid to say to your doctor, you know what? I need to talk to you about X, Y, and Z. I need someone, I am feeling a lack of sexual desire and I need someone to talk to about it. Can you please talk to me about it? And if they say, oh, I'll have a glass of wine, you'll be fine. Or, go out and have a drink, go for a date night. Everyone's going through it. No, that's not enough. Stick to your boundaries. I need actual guidance. And say, and if you don't have that, can you please refer me to somebody like Carli, who does have the tools to teach me how to reignite that and feel supported there. That's huge. And sticking to boundaries that maintain your security. If you don't feel like you want to have sex and your partner's like, come on, we haven't done it in so long. You're allowed to say, you know what? I don't feel like it today. I don't want to. These are the things I need you to do that would make me feel turned on. That's huge. And then do things in life that bring you joy on a daily basis. What brings you joy? Simple things that bring you joy. It could be your dog. It could be your cat. It could be the smell of coffee. My mom makes coffee in the morning. She doesn't even drink it. The woman doesn't even drink the coffee. She makes the coffee because the smell of the coffee in her apartment makes her feel so invigorated that she just smells it. That is something, seriously. She's like, I have a sip if I'm really tired, but it's the smell. What are these little things that you could be doing in each of your lives that brought you joy at one point that maybe you forgot the value of? I can guarantee you it exists. I could promise you in each of your brilliant worlds, that thing exists. One little thing. And then I like to envision, do you know what happens when all of us stand in front of the sun? What do you feel when you're standing in front of the sun? When you have the sun on your face, what do you feel? Does anyone know? What do you feel?
I feel a lot of warmth and a lot of energy. Yeah. And I feel very grateful to be able to have this very wonderful sense experience.
Yeah, the warmth, the gratitude, right? That feeling, the light. What's behind you when you're standing in the sun? I see someone raise their hand. What's
Cynthia, your hand is up.
A shadow?
A shadow, right? We all, as human beings in the world, when we are facing the brightness of our future, the sun, the warmth, the good feeling, we all have shadows. We all have shadows. The shadows are our pain, where we lack pleasure, where we are physically hurting, where we are emotionally hurting, where we are angry. We are not taught to talk about anger. We are not empowered to be enraged. That's not something we get a space to do. Does anybody ever fluff their pillows at night on their sofa? I fluff my pillows and I give it the biggest karate chop because you got to get that out. The shadow needs a space. That's what therapy is. I tell people all the time, I'm not afraid of your anger. Bring me your anger. Bring me your rage. Talk to me about your shadow, because you can only really feel the warmth of the sun if you're standing in the same space as your darkness. Right? If you really think about it, it's so profound when you think about it. So then here are the resource. Oh, and then my quote that I want to be known for in my life is, you're going to sleep, and forgive my dog with a very big voice, you are going to sleep with one person for the rest of your life. And that better be the best sex and the person you love the most. And that person is you. That's who you sleep with every night. It's who you sleep with. It's who you're with every day. It's who you spend your time with. That person's you. Be kind to you. Be good to you, dance with you, get sexy for you. Get off the phone with me today and go on Amazon and buy yourself some ridiculous lingerie and laugh about it. Laugh about it. Giggle. Be uncomfortable at the idea of putting it on. Let that be your shadow. That's okay. It's a place to start. And then here are some of the resources that I really stand behind. I don't promote anything or share anything that I don't stand behind or I haven't tried myself. OMGYes.com is the virtual masturbation tool for women made by scientists and doctors to empower you to learn how to have pleasure within your body. Vela is a vaginal serum to increase lubrication and blood flow to the genitals. So during cancer treatment, it can be really, really helpful by keeping the vagina to feel lubricated and also to have the blood flow in the vagina and the vulva to allow for you to feel the most amount of pleasure. I always suggest to people to engage in self-love and masturbation first before trying to engage with it again with a partner, even if it's been a long time since you've had intimacy with your partner or genital touching in a way that has felt good for you. Try it with yourself first. When you learn what you really like and enjoy, especially in your body as it is today, it can be very helpful to helping somebody else to learn how to pleasure you, especially as your body changes. Quim is a CBD lubricant that decreases vaginal discomfort associated with sexual touch. A lot of times with estrogen replacement or different medications that lower estrogen in the body as a result of cancer treatment. The vaginal tissue and vulva tissue can become quite thin, dry, and uncomfortable. And it leads to making the brain not want sex, because if the brain feels pain when the vulva and vagina and clitoris and body is touched or the breasts are touched, it signals to the brain that you don't want this said thing, including whatever touching that is. And so these types of lubricants can decrease the vaginal discomfort or body discomfort, and they can help you feel less inhibited and less afraid to engage in touch. And then Lilo is a beautiful brand with medical grade silicone. They make great vibrators. People think I'm crazy, but I think vibrators are wonderful. I think that they are when you've been disconnected to your vulva and body, or perhaps have had trouble feeling sexual desire. Sometimes utilizing a mechanism to help speed up the process to get you like, wow, I didn't realize I forgot what that feels like. For yourself, that can be really empowering. And so that's great. And then this is my information. I'm again, Dr. Carli Blau. I only get to call myself doctor since November, so it's very new. I'll probably get over it soon, but here we are. But I introduced myself as Dr. Blau the other day. I was like, what? And my mom was like, oh God, Carli. I was like, I only got it for a couple of months. I got to run with it. Gotta love it.
Better than Frau Blau.
I gotta love it. And then my practice is boutique psychotherapy, and that's the group practice. It's me and then the group practice with wonderful clinicians who work under my supervision and within my practice. And we're really working towards providing women like yourselves, brave people who are just standing in the sun with their shadows behind them and giving a space to support that. This is such a pleasure. I want to open up the room to questions. And I don't know how to, here, stop sharing my screen. And here I am. And if there are any questions, I'd be happy to answer.